Ethiopia's Gambella region is currently facing a major blood shortage. Most of the victims are bleeding profusely. The Gambella Primary Hospital said this afternoon that it is facing a shortage of medicines and blood for patients who were injured in the exchange of fire in various districts of Gambella region. It indicated that there are currently more than 65 patients at the hospital alone. A hospital official said, "We are having difficulty getting medicines because there is no activity in the city like the hospital. There's a shortage of medicines. We are waiting for assistance from various offices and partner organizations," he said. "What kind of medicine shortage did you face?" To our question, when a victim is seriously injured, especially if he is shot, we mainly face a shortage of painkillers, antibiotics, and medicines that help stop the bleeding. Currently, our biggest problem is the lack of blood. Most of the victims are bleeding a lot. There is no blood supply in the regional blood bank. So, we have asked the National Blood Bank to send us some blood, he said. So, has the blood support you requested been sent? How much do you need? To the question, we have not sent it yet. They say we will send it by tomorrow. It would be better if you give us at least 100 units of blood. We need at least 100 units. Because one patient bleeds a lot, he can use up to 5 units, he replied. Explaining the problem related to the shortage of medicine, he said the hospital is still struggling, and he said that they have asked the regional health office to send them the fluid medicine needed especially for bleeding. The doctor said that since yesterday, more than 50 people injured in the shooting in Etang Special District have been referred to Gambella First Hospital. He explained that 2 patients went to their facility because the road was closed. He also explained that 10 people were hospitalized in the previous attack in Tarfum, and 3 patients who were referred to Jimma last week are still receiving treatment after being referred to Addis Ababa. Since yesterday, how many injured patients have arrived at the hospital? A spokesperson for Gambella Primary Hospital, who was contacted by Sinal, said, "The injured people sent from Tarfum are the most seriously injured. We sent about 50 injured people yesterday. 2 of them died on the way. 48 have reached the hospital. They are currently receiving treatment. All 48 were seriously injured," he added. It is known that there was shooting in various districts before the Tarfum attack. How many victims came to the hospital for treatment during that time? To the question, there were people who were attacked on the road, including buses and hospital ambulances, he said. There are those who are reported to other institutions, the hospital management said, adding that only the Gambella First Hospital can directly report that 22 wounded people went to the hospital before the Tarfum clash, 10 died on the road, along with those reported by other institutions, and that the number of wounded people who sought treatment could be higher. In addition to the 48 victims who went to the hospital for treatment in the Tarfum attack, the management also said that 18 victims who went to the Lamek and Gambella hospitals in the previous attack are still in the hospital. In medicine, when asked if they had encountered any victims who died after reaching the hospital due to shortages or serious injuries, they said 1 victim died after reaching the hospital. They said that the wounded in the shooting included women and children, with 3 women and 1 child in the hospital and many others in other institutions. The closed road should be opened. Most of the victims who came to us arrived late. If there is a wound, it should be treated before it becomes infected. However, due to the road closure, the injured were sent after their parents had already become infected. They said, "We will ask the relevant institutions what was done to address the shortage of medicine and blood at Gambella Hospital."